Gastroesophageal reflux disease, GERD, is a chronic digestive disorder that affects millions of people worldwide. It occurs when stomach acid or, occasionally, stomach content flows back into the esophagus, the tube that connects the mouth to the stomach. This backflow, known as acid reflux, irritates the lining of the esophagus and leads to a variety of uncomfortable symptoms and potential complications if left untreated. Causes and mechanism. GERD primarily results from the dysfunction of the lower esophageal sphincter, LA, a ring of muscle at the bottom of the esophagus. Under normal circumstances, the LES opens to allow food into the stomach and then closes to prevent the stomach contents from coming back up. When this muscle weakens or relaxes inappropriately, acid from the stomach can flow backward into the esophagus, leading to symptoms of GERD. Common causes and contributing factors of GERD include obesity. Excess weight increases abdominal pressure, weakening the LES. Hiatal hernia, a condition where a portion of the stomach pushes through the diaphragm into the chest cavity. Pregnancy. Hormonal changes and increased abdominal pressure during pregnancy can lead to reflux. Certain foods and drinks, such as fatty foods, chocolate, caffeine, alcohol, citrus, and spicy foods. Smoking, damages mucous membranes, impairs muscle function, and reduces saliva production. Medications, including NSAIDs, calcium channel blockers, antihistamines, and sedatives. Symptoms of GERD. GERD can manifest in a variety of symptoms, ranging from mild to severe. The most common symptoms include heartburn, a burning sensation in the chest, usually after eating, which may worsen when lying down or bending over. Regurgitation, a sour or bitter tasting acid backing up into the throat or mouth. Difficulty swallowing, dysphagia, a sensation of food being stuck in the throat. Chest pain, sometimes severe enough to mimic the pain of a heart attack. Chronic cough, especially at night or after meals. Hoarseness or sore throat, caused by irritation of the larynx from acid. Nausea, in some cases, persistent reflux can lead to vomiting or feelings of queasiness. Not everyone with GERD experiences heartburn. Some individuals may have silent reflux, where symptoms are subtle or atypical. Diagnosis. To diagnose GERD, healthcare providers typically start with a physical exam and review of symptoms. Additional tests may include endoscopy. A flexible tube with a camera is inserted into the esophagus to look for inflammation or damage. Esophageal pH monitoring measures acid levels in the esophagus over 24 to 48 hours. Manometry tests the function and movement of the esophagus and LA. Barium swallow X-ray helps detect abnormalities in the esophagus. Treatment options. Treatment for GERD usually starts with lifestyle modifications and progresses to medications or surgery if needed. Lifestyle changes. Eat smaller, more frequent meals. Avoid trigger foods and beverages. Do not lie down immediately after eating. Elevate the head of the bed. Lose weight if overweight or obese. Quit smoking and reduce alcohol intake. Medications. Antacids provide quick relief by neutralizing stomach acid. H2 receptor blockers reduce acid production, example ranitidine, famotidine. Proton pump inhibitors, PPIs, more effective at reducing acid and healing the esophagus, example omeprazole, esomeprazole, pantoprazole. Prokinetics help the stomach empty more quickly, reducing reflux. Surgical options. For severe or refractory cases, surgical interventions like fundoplication may be recommended. This procedure involves wrapping the top of the stomach around the LES to strengthen it and prevent reflux. More recent procedures like Lynx device implantation also offer less invasive alternatives. Complications of untreated GERD. If left unmanaged, GERD can lead to serious complications, including esophagitis, inflammation that can cause ulcers and bleeding. Esophageal stricture, narrowing of the esophagus due to scar tissue. Barrett's esophagus, a condition where the esophageal lining changes, increasing the risk of esophageal cancer. Respiratory problems, including asthma, chronic bronchitis, or aspiration pneumonia due to reflux into the lungs. Prognosis and outlook. While GERD is a chronic condition, most people experience relief with appropriate treatment and lifestyle adjustments. However, long-term therapy may be needed in some individuals to prevent relapse and manage symptoms effectively. Early diagnosis and consistent management are essential to prevent complications and improve quality of life. With proper care, individuals with GERD can lead healthy, comfortable lives.